I am medical director of the New Orleans program. We're probably one of the oldest programs. My predecessor built a program that pretty much services the entire southern part of the country over around 35 or 40 years of his professional life. He was neuroendocrine when the entire United States of America was a medical desert. Now, I will tell you, though, in coming to this part of the country, Iowa, I think, is an even older program. So my predecessor was almost the closest friends with the people that built the Iowa program. So I call Iowa as probably the role model program because of the programs. I think they're the wisest of the programs. So a lot of us take our direction from Iowa. So why do I think that patient advocacy is so important? Is that so really what is patient advocacy? Is about helping people navigate what can be a very complicated medical field. And then on the next slide, I talk about what that's like for people with rare cancer diagnoses where we do a lot of guidelines and there aren't really particular standards. And so a lot of the medical decision is going to be based on unique features of any individual case. And then there's communication, meaning Mary Ann has a hotline, or you have a local or a regional support group member where you have someone as a sounding board that's going to be able to help you find resources. There are resources available. There are philanthropic organizations that will help patients get the care that they need. But if you don't know where to find it, because you aren't going to be able to look it up in the white pages, and the online is just so friggin' hard to sort of navigate around it, that's why patient advocacy groups like NCAN are so important for helping people to get what they need. And then obviously you have the patient support groups and the local and regional meetings like this. So NCAN does these meetings like 5-6 times a year to try to make sure that they're covering all of the national bases. And so if it's in Nebraska, and then it's in San Diego in June, it was in Atlanta in November, and I think they're just really trying to cover all their bases. And then you have access to resources, which are the local regional resources. And then I am huge, and I think probably Jim and Joe Dillon are probably also huge in trying to get patients to better understand what clinical trials mean and why would they be particularly important to patients with unusual cancer diagnoses. So this is out of Simon Sinek does this everything you do in life, you got to wake up in the morning and say, why do I do all this? And so why advocacy is so important for this patient population is that I've lived my entire professional life building cancer programs for what we call marginalized patient groups. Those are patients that are pushed to the periphery of mainstream medical practice for a variety of reasons, and that can be for a variety of reasons that are relevant to this part of the country, for a variety of reasons that are relevant to the southern part of the country. But a lot of it are the easy things, like poverty or socioeconomic class, or your ability to even get somewhere because you don't have a car. But it could also be that you live in a really big rural state, and the regional center is going to be 3 hours away, 4 hours away, like we have in Arkansas, or that you have no center whatsoever, which is like the state of Mississippi. But that it's also the rarity of a diagnosis where there are papers out there talking about your outcome being dependent on you being able to find a physician that's either comfortable with the diagnosis, understands the evaluation and management of the diagnosis, but also has the resources and or connections to get you the treatment that is required. And then, so the objectives of this type of a meeting is to build relationships with other patients and caregivers. That's the you are not alone, type of thing. So you start to meet people that are even from your area. You meet your team, leader. You meet people like Mary Ann that have personal experiences that all of you are going through, or Bob as a caregiver has also gone through. But it also has established a connection with NCAN, one of the grassroots patient advocacy organizations that can help you navigate some of the complexity. And then it brings national subspecialists to local and regional groups. And I think for this type of thing, you may have a really great local area within Omaha, Nebraska, but that it then brings the Omaha, Nebraska specialists in with the Iowa specialists, which apparently, you can tell I'm not from this part of the country, is only like 4 hours away. And then it says sort of the update on the surgical and medical management so that you can understand what's either currently available or coming down the pike. And then you review clinical trials that are relevant to certain subsets of patients. And you have people like Raise Bio here or Crinetics here. You actually have the people that are a part of building clinical trials that may very much be relevant to you or to other patients within the area, and you're just here to be able to ask questions. It brings us into local areas so that you can even sit and have breakfast with us, and I had a really nice conversation. I mean, it just takes away a lot of that whole, I don't know, your blood pressure goes up the second that you walk into the doctor's office. And then you meet key industry partners that are very much committed to neuroendocrine. I would like to echo what Mary Ann Wayman said, is that when you go to huge national meetings like we go to, and you've got 18 people telling you, genetic testing and things like that, it's really hard to sift through what is even relevant. The people that come to these meetings come on a Saturday because they are truly committed, and it's all very much relevant to you. So that's my little, warm up. And then I think we were going to start with who's first.
Dr. Dillon. So
Dr. Dillon. We got Iowa. Yeah. So Dr. Dillon is going to talk about following your disease using serologic markers.